Hi, medical students, welcome. This is Rocky Vista Health Center. This is our introductory video to show you what you're going to need to know when you come here for your capstone project. I'm Dr. Stephanie Kraft. I'm one of the attending doctors here.
I'm Dr. Ellie Barsh. I'm a resident.
And I'm Wendy Mosley, the clinic supervisor.
All right, so goals for your capstone half day here. So the main goal is just to get some familiarity with how an outpatient clinic looks like prior to starting your clinical rotations. So we know that you probably haven't had a lot of time yet in clinics. We want you to have a general overview of how a clinic practice runs on a day-to-day basis. We also want you to become a little more familiar with how to take vital signs, how to talk to patients and room patients in a real-life live situation, not just a standardized patient. And then finally, we want you to be able to practice writing a history of present illness, an HPI, which is one of the main things you'll need to know when you first start your clinical rotations. So you will practice doing that with at least one patient while you're here on your half day. You'll also upload that to MyVista to get credit for the course.
Okay, hi guys, this is the Rocky Vista Health Clinic, so come on in. So here we have our waiting room and our lovely front desk staff.
Ladies.
We have Andrea, wave hi, Kiara and Britt. So this is where patients will sit when they kind of first come in. And this is also where you'll be grabbing them when you take them back to get vitals into the exam room. So, you'll first walk in, and on our right, you have our clinic supervisor, Wendy, here. And then as we come down the hallway, we have exam room 1 right here. And then we have all of our exam rooms down here, and then I'll take you back to where all of the residents sit. So back here, it's all of our residents. Say hi, Mie. And this is also where you'll be putting your stuff down when you first get here. And then we'll keep kind of walking through the clinic here. So here is where you'll do vitals, which will show you guys kind of how to do. And then we have more exam rooms. We have our lab here. And then we have our bathroom that you are welcome to use here on the left. And then on our right is our MA's station.
Minus the MAs, they're all busy.
And then back here is our attending's office. Our lovely Dr. Burke.
Hi.
And then, as we keep going back here, we have more exam rooms. And then a little maze through here. These are mainly the OMM rooms that will be used here. And then in the all the way back, we found our MA who was hiding, Osh. This is our break room. And so we have water that you can get over there. We also have coffee, and there's Sandra, our other lovely MA. Hi. And yeah, that's kind of the tour of the clinic.
Welcome back. Okay, a few things to know before you get here. First, arrive on time. You need to be here by 7:45 a.m. You'll come to the front desk, check in. They will bring you back to Wendy, who will then help you get some paperwork signed. You need to wear business attire clothing. You need to bring and wear your white coat, and please bring your stethoscope as well.
Okay, so we're gonna start with taking a blood pressure. What you want to notice on Wendy is that she is wearing a pretty thin shirt here, so it's okay for her to kind of just measure the blood pressure over the shirt. However, if you were wearing something thick like this, I would recommend asking them to take it off to get an accurate blood pressure. So what I'll go ahead and do is kind of wrap this around here, and then as you see the artery index marker for the brachial arteries where you want that to be directed to. At the same time, what I'm going to go ahead and do is grab this pulse ox and stick it on her finger, and you just press the power button on like that. Let her sit peacefully, and then we can go ahead and just press the power button. Okay, now we're going to show you how to room a patient and get some vital signs. So you'll first want to go to our front desk staff and ask them if the patient's ready. So I would just say, hey Britt, is Wendy M ready?
Yes, she is.
Okay, so then I'm going to go over here and Wendy M. And then you'll have your patient come back. Thank you for coming with me. Okay, now we're going to go ahead and take some vital signs. So what you want to kind of first do with the blood pressure cuff is make sure that their legs are uncrossed. And as you notice, kind of Wendy's wearing a thin shirt, which is okay to measure the blood pressure over that shirt. However, if you were wearing something thick like my jacket, you want to ask them to take that off to get an accurate blood pressure measurement. So what you'll go ahead and do is put the cuff on here. And as you see, there's always this artery index marker which tells you where the brachial artery should be lined up with. So wrap that on, and then as I'm doing this, I'm going to go ahead and take our pulse ox, which is just a little power button on here, and stick it on her finger. And then you can let this sit and go ahead, turn the blood pressure cuff on. It'll start measuring her blood pressure. At the same time, what I'll go ahead and do is get a temperature. So with this, you just press the button on. You make sure that it's close to their face, not touching their face. Maybe I'll do that once more. And there's an accurate temperature. And then as you're doing all of this, you can be documenting on your sheet here what vital measurements you're getting. So I would document it on here. And then once you get all of these documented, you can go ahead and take the blood pressure cuff off and take the pulse ox off as well. Also note that there are wipes here to kind of sanitize after you're using these, okay? And then we can go ahead and get a weight and height, which we will do for all new patients and all physicals. So, Wendy, if you don't mind, kind of stepping up here, what I first need to do is just press the on button. It does not say on, it's just a blank button.
Sometimes you have to push and hold it down for a minute. That should be okay. Or not. Or you use the special touch of the office manager. So now it's zeroed and it says 0, 0. So it's ready to use.
So you'll have her step on. You'll get a weight. Thank you. You can go ahead and step back. And then to get a height for, once again, all new patients and all physicals, what you'll do is you'll kind of push this thing up, squeaky, or it's not a squeaky this time. And then, Wendy, would you mind kind of stepping over here? You'll get a height and kind of slowly bring it down to right where their height is. And then you can go ahead and step forward. And then what you document is the number right here. So it'd be 171.
In centimeters. Yeah.
Centimeters.
But you can write it down in inches actually. And so in this case it'd be 67 and about a half inches.
All right, now we're gonna go ahead and room the patient. So what you first want to remember is on this sheet, it tells you what flag colors your resident is. So you would go ahead and first kind of move whatever flag color it was. If it's red and green, then you just put up red and green for that specific resident you're paired with for the day. And then you would kind of ask the patient to come on back. Wendy, if you don't mind coming with me here, you can go ahead and take a seat over there. One thing to note is you want to make sure the room is clean prior to entering the room with the patient. So for example, if it looks like somebody had sat here, go ahead and just pull it down and rip it off to make sure it's a new kind of sheet, okay? And then you want to go ahead and get a chief complaint. So you would just ask the patient, Wendy, what are you here for today?
I've had a sore throat for about 3 days.
And that's your chief complaint, sore throat for 3 days.
Okay, so now you've roomed the patient. We're back in the bullpen. Dr. Barsh, how would you like the medical students to present the patients to you?
Yes, I will give you an example. So I have Mr. John Smith here. He's a 67-year-old male. He's here for a sore throat for 3 days. Vital signs are blood pressure 114/79, pulse of 79, O2 sat of 97%, and he is afebrile. His height is 67 inches and his weight is 143 pounds today.
Okay, so now you've presented the patient to the resident. You are then going to follow the resident into the exam room, participate by shadowing the resident while they speak with the patient, do their full exam with the patient. Then the resident will take you back to the attending area where you can listen to the resident present the case to us, myself, Dr. Burke, or Dr. Davis. So I'm back again here in one of the exam rooms. So you've presented the patient to the resident has examined and then presented the patient to the attending. While you're doing all this, it's important to keep track of the time. If you look at your schedule and see that you have patients every half hour, make sure you look at the clock, and if it's getting close to the next appointment time, either ask the resident to check the schedule on the computer or go back up to the front desk and ask one of the front desk assistants, hey, is Mr. Smith here yet? Because if they are, we want you to go ahead and room that patient next, even if the resident is still presenting to the attending. We'd like to keep the clinic flow on time as much as possible. Now, at the end of the morning, we do want you to take a little more time with the last patient in the morning so that you, beyond the chief complaint, can get the full history of what's going on. So pick one problem that they're here for today. So let's say the patient's here for diabetes. We want you to get an HPI for their diabetes. So you're learning in school, what constitutes a good history of present illness. We want you to go ahead and practice that with that patient in the room. And then with that last patient in the morning, when you present to the resident, not only will you present the chief complaint, but you can present the HPI. And in fact, we may have you just present that to the attending and the resident at the same time, which gives you extra practice for presentations. So that's pretty much it. Welcome to the clinic. Hope you have a great experience, and we're always open to feedback. Thanks.